Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is Cheryl Myers, and she is going to be speaking on the topic of health and vitality for men. Thank you so much, Cheryl, for joining us.
Thank you. I am absolutely delighted to be here. So, for those of you whom I've not yet met, my name is Cheryl Myers, and I'm the head of scientific affairs and education for Europharma. Europharma is the parent company of the Terry Naturally brand of dietary supplements. I've worked in integrative healthcare for 26 years now. Prior to that, I worked in mainstream healthcare. I've been fortunate enough to have been interviewed by some prestigious organizations like the New York Times, the Wall Street Journal, and Prevention Magazine, where I like to put forth the idea that the best health outcomes occur when we weave together all that the world of medicine has to offer. Some of that might be mainstream medicine. I'm not against mainstream medicine. As I have said many times in the past, if I get run over by a pickup truck, please do not take me to an aromatherapist. Please take me to the closest trauma center. Mainstream medicine does trauma really, really well. But there's many things, and we don't find the answers in mainstream medicine. Chronic diseases, complex illnesses, prevention, recovery. There's just a lot out there that is scientifically investigated and clinically proven to provide a health benefit. And I think it should be respected as medicine. So let's get started talking about men's health today. And we cannot talk about men's health without talking about the dominant man's sex hormone, which is testosterone. So as you can see, men peak with testosterone somewhere between 18 and 22 years of age, and then it starts to fall off a little bit. By the time gentlemen are 80 years old, yes, indeed, they still have testosterone on board, but it just becomes lower and lower and lower with age. This is a naturally occurring decrease. However, there are lots of things that can make this decrease happen even faster, and there are lots of complications that can occur when people start to drop off, when men start to have lower testosterone levels at younger ages. So why do men need testosterone? Well, the obvious has to do with libido and erectile function, and that is absolutely true. Men do need testosterone for that. They also need it for sperm count. Some causes of low sperm count have to do with inadequate production of testosterone. Sometimes when men, especially when men are over the age of 30, especially if they're carrying a little bit of extra weight, especially if they are exposed to a lot of estrogenic activity from compounds in our foods and plants, like, for example, BPA in plastics, that's a fake estrogen, can develop breast tissue. And men can be very, very embarrassed about this. It contributes to fatigue and low energy, feeling down, not feeling like you want to go out and do anything. Now, ironically, low testosterone can cause irritability, and high testosterone can cause irritability. We also see issues with bone thinning, and especially when men start to be past the age of 50, lower testosterone levels, we start to see some problems with the bone. You need a goodly amount on board to keep those bones strong and active for a long, long time. And reduce muscle mass and more body fat. And muscle mass is important for a lot more than just lifting the heavy things. Muscle mass is important for movement, for stability. Muscle mass burns more calories at rest than does any other tissue in the body. And so having a goodly amount of muscle mass is associated with healthy longevity. So yes, men need testosterone for lots of different reasons. Now, if you watch a lot of TV, especially late night infomercials, you'll see they've created a new term called low T. Low T, my gosh, the number of different kinds of commercials I have seen for this. Now, it is true that male testosterone levels have been declining for decades. Why is this? Well, because men's bodies are not producing testosterone because there's a lot of impediments. You heard me mention before the fake estrogens in our environment. One I picked on was BPA in plastics, bisphenol A. This compound in plastics, we all know we're supposed to look for BPA-free water bottles. But did you ever wonder why it's not just that it's toxic, it's that it's estrogenic? That's why BPA has been associated with both prostate cancer in men and breast cancer in women. is because of this. They call it xeno, meaning foreign estrogen activity. There are a lot of other compounds that are used in food. When we buy food that's not organic, we buy produce that's been treated with pesticides and herbicides that are in a class we call endocrine disruptors. Those are also, they also exert fake estrogenic activity. Fat cells make estrogen. And so when men are struggling with overweight or obesity, they have that additional challenge of having more estrogen in circulation, which impairs the body's ability to convert testosterone into the most powerful form, which is free testosterone. When we look at testosterone levels in young men under the age of 40, over the last 17 to 20 years, there has been a 25% decline. The best known study was published in 2007, and they found that a 60-year-old man in 2004, on average, had testosterone levels 17% lower than a 60-year-old man in 1987. So whatever we're doing to our food supply, whatever we're doing to our environment, this is not good for men's health. The average testosterone drop is about 1% a year after the age of 30, but as I said, that can vary greatly. Some contributing factors to suboptimal levels of testosterone include carrying extra weight. When we look at waist size, for example, and a lot of men struggle with having extra adipose tissue or fat tissue around the waist, the spare tire, so to speak. When they found a 4-inch increase in a man's waist size, increases his odds of having low testosterone by 75%. And it also equals what 10 years of aging would have done. So even a 2-inch waist gain around the waistline can impair testosterone activity. Strength training increases testosterone. So if you like to have some strength training and some resistance training, working with weights, please do, because this is really one of the best known ways to build more muscle tissue and to increase testosterone levels. But another problem area is alcohol. Now, if you have a glass of red wine every now and then, I wouldn't worry about this too much. But excessive alcohol intake is directly toxic to the very cells that make testosterone. And beer especially is high in sugar and carbohydrates and calories. And some of the compounds in beer also stimulate this fake estrogen or xenoestrogenic activity that can increase fat deposits, especially around the waist and in the chest area. Sleep. Who knew? If you are getting inadequate sleep, if you are short sleeping, it can reduce testosterone levels by the same amount as aging 10 or 15 years. We need our sleep for our bodies to do their job. And part of that job is to relax, to rebuild, to restructure, and to refresh the things that we are low on. And I mentioned before toxin exposure. I talked about the BPA in plastic, but there's another class of toxins called phthalates that reduce testosterone secretion. And every time you double the amount of phthalate level you are exposed to, that reduces testosterone levels for about 8%. So that's a kind of a scary world out there. We have not been very good shepherds of our environment. We have a lot of guys out there that are exposed to a lot of things that challenge healthy testosterone levels. Fortunately, there are some natural compounds that can help boost testosterone. One of them is ashwagandha. Ashwagandha is an herb that we see in the Indian practice of medicine called Ayurveda. Ayurveda is one of the oldest continuously practiced medical systems in the world, and ashwagandha is one of its crown jewels. In fact, ashwagandha means smells like a horse. Now, I don't think horses smell bad myself. I think horses smell fresh and clean and wholesome and outdoorsy. But what they mean by that smells like a horse is the essence of the horse, the spirit of the horse. Excuse me. And they mean that with regards to strength and stamina. In one study of a specific kind of ashwagandha with a high standardization of with analytes, they saw that it could increase testosterone levels by as much as 33%. However, women can use ashwagandha as well, but they don't see a significant change in women. And you may wonder, well, why is that? It's because women don't have very much testosterone to begin with. The more testosterone you have, the greater the increase. The less you have, it's a very insignificant level. Now, there's another compound that helps boost testosterone, and that's called DHEA. This is a hormone that's made by the adrenal glands, and DHEA is one of my favorite compounds in the body. Sometimes I call DHEA spackle because it fills in the cracks. Let's say you're a lady and you're going through menopause and you've had a sudden drop off in estrogen. Your body does not like cliff events. Your body does not like sudden changes. Some of that DHEA will turn into estrogen to cushion the blow. Let's say you're a gentleman and you're struggling with low testosterone. Your body doesn't like those sudden changes. A little bit of that DHEA can convert into testosterone. Another compound that's crucially important to help with healthy testosterone production in the body is vitamin B6. Vitamin B6 acts directly to increase testosterone. It also helps to reduce those estrogenetic compounds that are in the body that are interfering with proper testosterone activity. In fact, low vitamin B levels have been linked to low testosterone and increased estrogen in animal models. Now, there's two forms of vitamin B6. There is the inactive form, that is pyridoxine hydrochloride, or just pyridoxine. You will see that in most supplements or in food. And when you take the inactive form, it travels to your liver. Your liver does a little presto changeo to turn it into the active form, which means your body can use it. The active form is called pyridoxal 5-phosphate. You don't have to remember that, just remember P5P. So regardless of whether you are a good converter, a bad converter, or an average converter, this doesn't matter because it does not have to be transformed by the liver. And there is up to 50% of our population that because of illness or medications they're on, or even just their genetics, that are not the best converters of the B vitamins. So better to bypass the middleman and go straight to the P5P. Zinc seems like such a simple ingredient, but zinc is crucially important, as is boron, for increasing testosterone and for increasing the free form of testosterone. So when you start to put these together, you can see that you can construct a formula that can have some pretty powerful input on helping men with healthy testosterone levels. Now, there's another compound that's really useful for both men and women, and it's another one of those botanical ingredients that's a total mouthful. It's called diindolylmethane, DIM, D-I-M. Now, you can find DIM in broccoli and cruciferous vegetables and cauliflower, bok choy, Brussels sprouts, but you would have to eat 2 pounds of raw broccoli to get the amount of DIM that's necessary to act as a natural medicine. DIM does not raise or lower testosterone. DIM does not raise or lower estrogen. It keeps it in the safest, most productive form. So it frees testosterone that has been bound so that it is the free form of testosterone that contributes to all those health benefits we talked about. In a clinical study of male patients undergoing treatment for prostate cancer, they were treated with DIM. Now, they didn't see a 38% increase in all testosterone. They saw a 38% increase in the better form of testosterone. So less was in the negative form, more was in the positive form. And in men with prostate cancer, low testosterone levels of the healthy form are linked with an increased risk for advanced cancer. So if you're looking at trying to use some natural compounds to boost testosterone levels in the body, it absolutely can be done. However, this is one of those caveat emptor, buyer beware situations. There are some just dreadful products out there. One of them that was recalled just last October was called The Rock. The Rock was supposed to enhance male sexual performance, increase testosterone levels. What they found is that it was tainted with, it was adulterated with sildenafil, and sildenafil is the generic of Viagra. Now, you might say to me, oh my goodness, who would put these drugs in dietary supplements? Because Viagra is super expensive. Cialis is super expensive. I don't know, last time I looked, maybe $10 a pill. How can they afford to do that? Well, it's because Viagra does not cost $10 a pill. If you make illegal Viagra, if you follow the chemical structure and make generic Viagra without a license, it costs pennies. So what they're doing is they're making this illegal drug and spiking these products with it. That's really frightening to me because there are certain drugs that can interact with sildenafil and can cause life-threatening complications. And if you're a man, maybe you're avoiding Viagra and Cialis because you're on those prescription drugs, and then you buy something that you think is natural and end up in trouble. When they looked at the number of products that are on retail shelves, this was a study done in California, 67% of the products tested positive for adulterants, 60% contained 2 or more adulterants. And when you looked at convenience stores and truck stops, those numbers increased dramatically. So it's crucially important to be connected with a quality independent health food store that does the homework for you, that finds the products that they are sure are exactly what they say on the label, that don't contain any adulterants, and that can provide the benefits that you expect. Now, moving on to another issue that some men struggle with, and that is prostate cancer. Now, prostate cancer is a family of cancers. It's not just one thing. The most common form of prostate cancer is one of the slowest growing cancers ever. If you get the slow growing kind, it may be 20 or 30 years before you have serious problems with that cancer. And if a gentleman is 80 years old and the doctor finds he has prostate cancer and it's the slow growing type, he probably is not going to do advanced surgery. They call those radical prostatectomies. Because when you remove the prostate, 2 bad things can happen. Number one, men can become incontinent. They can run into issues with no longer being in control of their urine. Most men do not like that, having to wear protection or Depends or something like that because they can't control their urine stream. Another bad thing that can happen is the complete inability to achieve an erection and perform sexually. It's my understanding men aren't too keen on that either. So doctors are trying really hard not to do prostatectomies unless they absolutely have to. So they adopt something called watchful waiting. Now, I'm going to take a step away from what we're talking about. If you have the advanced form of prostate cancer, absolutely it behooves you to have that removed. I'm talking about the more common, very slow growing form. So the way doctors monitor it is for every 6 months or every year, the man goes to the doctor's office and they do 2 things. The doctor evaluates the size of the prostate gland, and they draw blood and they do something called a PSA. That stands for prostate specific antigen. If those numbers suddenly shoot up, if all of a sudden the PSA is stratospheric and the prostate is starting to grow, they realize that the cancer has become far more active and they have to take more dramatic steps. But if the PSA is low and there's no significant change in the size of the prostate gland, the doctor says, good job. We'll see you again in 6 months or a year, whatever schedule they have a gentleman on. So one of the things that's very useful is to look at what nutrients can we use to help keep those prostate cells normal, to help our immune system do a better job at keeping prostate cancer at bay, and to keeping those PSA levels lower and closer to the normal range. Now, some gentlemen have asked me about BPH, which is different than prostate cancer. That's benign, meaning not cancerous, prostatic hyperplasia. It's the overgrowth of prostate cells for lots of reasons. The vast majority of men, if they are blessed with a long enough life, are going to develop some level of BPH. What you see with an enlarged prostate is it presses against the bladder and it presses against the urethra. The urethra is the tube that connects the bladder to the outside of the body. So if you have some impediments there, if you've got something pressing against the tube, You may not be able to urinate very successfully. I mean, you'll urinate a little bit and then stop. And a lot of complaints about flow, start and stop, start and stop. If it's pressing against the bladder, again, it can impede flow, or it can make you feel a greater sense of urgency. Now, this is an incredibly annoying problem to have, and the larger the prostate, usually the more significant the symptoms, but we can certainly deal with that. It is not life-threatening. It does not spread to other areas of the body. And as I said, the symptoms mostly affect urinary activity. Prostate cancer, on the other hand, some of that can be a bit of an overlap. You can also see an enlarged prostate. You can also see the prostate press against the bladder, press against the urethra. It can also affect urination, but the other symptoms and the fact that it can spread to other parts of the body make it far more problematic. Now, there was a study specifically on curcumin. Now, curcumin is a compound that is found in the turmeric plant. I like turmeric as a spice. If I'm making a curry, I am always adding turmeric to it. But turmeric does not contain very much curcumin, only a tiny little bit, maybe 2% to 5% of turmeric is actually curcumin. So if you're trying to use it as a medicine, you need to take the curcumin out of the turmeric and concentrate it so you get more powerful benefits. Neither turmeric nor curcumin absorb very well. So when you're looking at using botanicals as natural medicines, you need to pay attention to boosted absorption. And the form that was used in this specific study used a curcumin that was called BCM95 that had boosted absorption utilizing turmeric essential oil, nothing Frankenstein or weird, and it boosted absorption about 7-fold. There were 40 patients being treated with radiation therapy, external beam radiotherapy, because they had prostate cancer, and also drug therapy to try to reduce their hormone levels back to normal. They used this curcumin with the turmeric essential oil 3 times a day, 2 capsules 3 times a day, so relatively high dose. They found some amazing benefits. Number one of the side effects of radiation therapy for the prostate has to do with urinary frequency or urinary pain or urinary leakage, lots and lots of issues having to do with the urinary tract. They saw a 50% reduction in numbers of men with daytime urinary frequency and a 30% reduction in men with sleep disturbances, the kind of gentlemen that are being awakened all night long because they have to get up and go to the bathroom. So this was a very, very positive study. And one of my favorite parts of the study is that the researchers mentioned that they saw no evidence whatsoever that using this curcumin blended with a unique turmeric essential oil interfered with the radiation therapy or interfered with the treatment's ability to kill those cancer cells. So a natural formula for men that have the slowest growing form of prostate cancer and that are trying to keep everything settled down and quiet and in the normal range would start with having as the backbone of that formula that unique curcumin that has been clinically studied. Also, grapeseed extract. Grapeseed extract has been found to be very, very protective against the development of prostate cancer. It has some other activities in the body, including how it interacts with excessive xenoestrogens in the body. There's a compound in the botanical milk thistle called silibin, and silibin has been shown to help with reducing prostate cancer issues and helping to improve cancer cell death during treatment. Something as simple as vitamin D. A recent study found that men with low vitamin D levels were 4 to 5 times, that's 400 to 500%, 4 to 5 times more likely to have aggressive prostate cancer than men with normal vitamin D levels. Oops, kind of jumped behind, didn't it? Sorry. So the last, but certainly not least, another one of my favorite botanicals is pomegranate. Pomegranate contains some amazing compounds, including punicic acid, that has been shown to kill prostate cancer cells, slow the spread of prostate cancer, and pomegranate also has some excellent studies to help people that are struggling with cardiovascular disease. Now, for those men, regardless of why they have to get up all night long to urinate, which, by the way, this is not just an annoyance, this is very detrimental to health. You should be able to sleep at least 4 hours in a row in order to go through all the healthy sleep cycles. If you are sleeping 2 hours and then you're sleeping 3 hours and then you're sleeping 1 hour and you're popping awake because you have to urinate, that's a problem for lots of reasons. You're not going to have the same level of detox. You're not going to have the same consolidation of memories because memories are consolidated while we sleep, everything we learn that day. Other issues with low sleep, not going into the deepest stages of sleep, reduces the amount of human growth hormone your body can make. And human growth hormone is crucially important if you want to live long and prosper. So we need to help get men. If you wake up once a night, that's entirely doable. If you can sleep 4 hours, wake up, and then sleep for another 3 or 4 hours, entirely doable. And that's where the Icelandic variant of Angelica Archangelica comes in. This has been clinically studied in men with low bladder capacity, regardless of cause. It extends by as much as threefold or 300% the amount of time a man can sleep until he wakes up for his first nighttime urination. It increases bladder capacity. It reduces the number of times men have to get up all night long to urinate. It's also effective for women. If women are struggling with these issues, it's also very effective in the daytime for people that have irritable bladder or people that have problems with, especially women sometimes struggle with losing a few drops of urine when they sneeze or they cough or laugh too hard. It can be very useful for that. It's a wonderful bladder supportive herb. So what to know? If you are dealing with PSA levels, if you're dealing with a watchful waiting situation, or if you are concerned about that and you're using compounds preventatively, then that formula of curcumin, grapeseed extract, silibin from milk thistle, vitamin D, and pomegranate can be really beneficial. And if there are additional problems with full bladder emptying or the ability to sleep all night long without awakening to urinate, then I would add in the 100 milligrams of Icelandic Angelica Archangelica. Now let's move on to sexual dysfunction. And I know that this can be embarrassing for some people to talk about, but sexual health is health. It's another aspect of health. If you are not able to maintain an erection, if you are having problems with circulatory issues with regards to the filling of the penis in the first place, those are health issues. This is not that you aren't trying hard enough. This is some issues that are going on with health that need to be looked at because those very same issues affect brain health and they affect cardiovascular health. So we need to look at what can we do to bolster the natural processes in the body so that things start to work the way they're supposed to again. Age is a factor. Smoking is a factor. Excessive use of alcohol can be a factor. Diabetes, gentlemen with type 1 and type 2 diabetes can very often, because of circulatory issues, have some problems with erectile dysfunction. Blood pressure problems and the medications used to control blood pressure can interfere with sexual function, obesity, and several kinds of cancer. Now, one of my favorite herbs to help with, excuse me, erectile function is red ginseng. This is Panax ginseng. Don't be confused. There is an American ginseng called Panax quinquefolius. It's a useful botanical. It is a cousin. It is not the same. Panax ginseng is sometimes called Korean ginseng, Asian ginseng, Chinese ginseng. You're getting the idea. Panax ginseng contains an amazing spectrum of compounds that have been clinically studied and shown to help with erectile dysfunction. In this one study, looking at 15 questions on sexual function, things like frequency of erections, duration of erection, sexual desire, satisfaction, the red ginseng group during this 8 weeks reported improvements in every single measurement. Now, I have to emphasize that using botanicals and using natural products to help improve male sexual function is not a date night event. This is not something you take and all of a sudden, voila, there's going to be enormous changes. This is something you have to use for a minimum of 6 weeks. 8 weeks might be even better. in order to continually rebuild and help restructure some of the problems that are interfering with success. There's also a blend of apple and grape polyphenols enhanced with saffron. Saffron contains polyphenols as well. This blend has been clinically studied to increase nitric oxide production. Now, nitric oxide relaxes smooth muscle and it relaxes the walls of our blood vessels, vasodilation. In order for a penis to fill with blood and for the blood to stay there, you have to have excellent nitric oxide production. You also have to have excellent blood flow so that you get a release of the erection when you are no longer needing it, so that that blood flows back in a healthy manner back into the body, that you are not dealing with a lot of vasoconstriction issues. So I love this apple, grape, and saffron because it has been clinically studied and shown to help with male function. This is the study that was done on those ingredients. There were 94 men ages 45 and up. And what they looked at was week 1, week 2, week 3, week 4, and before use of this. And what they found is by week 4, 72% of the men had a significant improvement on a standardized scale of erectile function. It was very, very effective and no serious adverse effects. So what to know? Using ginseng with the apple and grape polyphenols, along with saffron, that triple group of polyphenols can be extraordinarily useful. I told you to give it at least 6 to 8 weeks, and you should. However, some people notice a difference within a week or two. Just know that with continued use, you're going to have a continued improvement. I would also be remiss if I didn't mention curcumin on its own when it comes to men's health. We could probably play a game of what kinds of conditions would not benefit from curcumin. I don't think you could come up with one. There's no disease or no injury of which I'm aware that curcumin could not provide very, very significant support. There are studies, as if you go on to the National Institutes of Health electronic database, that's available at PubMed, P-U-B like public, M-E-D like medicine, pubmed.gov. Make sure you go to .gov or you will end up somewhere else entirely. And you type in the search term. It's a free searchable database. You type in curcumin, there's over 20,000 published studies on curcumin. Everything from atherosclerosis to ulcers to pancreatitis to breast cancer to asthma to bronchitis to diabetes to Alzheimer's to Parkinson's. The list goes on and on and on. Quite honestly, I believe that every kid that graduates from high school should be handed a bottle of enhanced absorption curcumin. If they started taking 1 capsule a day, I swear, they would probably add, on average, 10 years to the lifespan. Additionally, another super potent compound are OPCs from grapeseed. Now, you've heard me mention grapeseed before. But men struggle with heart disease. It's the leading cause of death for men in the United States. 1 in every 4 American men dies of heart disease. And men develop heart disease on average about 10 years earlier than women. 50% of men who die suddenly, guess what? Guess what their first symptom of a heart attack is? Death. 50% of men who die suddenly from coronary artery disease had no previous symptoms whatsoever. Grapeseed extract is fantastic to help keep the heart healthy. It reduces blood pressure. It reduces the plaque buildup in the arteries. You know, those arteries get gunky and then we don't have proper circulation. And it reduces abnormal blood clot creation. Now, it's not a blood thinner. If you're taking grapeseed extract and you fall off your bike and cut your leg, you're not going to bleed excessively. But it helps to reduce those abnormal blood clots that if they get stuck in your heart, is a heart attack. If they get stuck in your brain, it's a stroke. If they get stuck in your lungs, it's a pulmonary emboli. If it gets stuck in your leg, it's a DVT or a deep vein thrombi. So what we want to do when we're looking at helping to support men, to keep them healthy, to avoid If possible, avoid the risk factors for heart disease, or if heart disease is already developing, to slow or maybe even stop the progression. Curcumin, not turmeric, 750 milligrams, with the turmeric essential oil, of course, at least once, twice a day. And OPCs, tannin-free OPCs, that's a grapeseed extract that we see as the dosage is 150 is kind of low. That's good for prevention if you're otherwise healthy. If people are struggling with blood pressure, or if they're starting to have a little trouble with atherosclerosis or other issues, I would start with about 300 to 400 milligrams a day. Well, that was a lot of information on very many aspects of men's health in a short period of time. So I thank you all very much for your kind attention. I hope that you will contact Marlene's, or go, better yet, go give them a quick visit if you have questions about how to utilize any of these supplements to improve men's health. And now I'll open it up for any questions. Elizabeth?
Thank you so much, Cheryl, for the fabulous presentation. Those numbers about the testosterone levels decreasing over the last 25 years, I mean, or it was 17. I thought that was like very, like it, very frightening to um how the environment has affected us. There's no avoiding it with those test results.
Absolutely. Absolutely. You know, we have not been very good shepherds of our world, but it's never too late to clean up our act. We need to vote our conscience. We need to get rid of a lot of the plastic pollution and the microplastics that often contain compounds that act like fake estrogen in the body. We need to move towards getting these pesticides, herbicides, fungicides that disrupt our hormones, get them out of our food supply. There's just so many things we can do to live longer and healthier lives and not have to deal with these struggles.
Exactly. And we should be looking to strengthen our health and vitality as a society, and also give give thanks to the earth that helps gives us you know gives us the vitality.
Right. Absolutely.
Wow. Well, thank you so much, Cheryl. I always learn so much with your classes.
Well, thank you. It's always a pleasure. You know, it's so important that there is so much information out there that's negative towards using natural interventions. And people that are told by mass media or their next door neighbor that it's all hooey and it's all voodoo. And I am absolutely right on board to say that there are bad players out there. But there's bad players everywhere. There's bad players in the food world, the clothing world, using child labor. There's bad labor. There's bad players in the pharmaceutical world, for sure, for sure. Of course, there's some bad players, but that doesn't mean that there are not legitimate, clinically studied, scientifically proven natural medicines that can have a huge impact on your health. So thank you for helping us get that information out there.
Of course. It's my absolute pleasure, and I just feel honored so much to be a part of this program and be able to interact with wonderful health practitioners and advocates like you. So thank you
Thank
so
you.
much, Cheryl.
Thanks so much. Take care.
You too.
Bye-bye.
Bye.